The following is a presentation of Project Independence and WCWP. Project Independence is the Aging in Place initiative of the town of North Hempstead. We provide programs and services designed to assist and support the older town residents who wish to remain in their homes as they age. If we don't currently provide a service, we will try and connect you to that service. Call 311 or 869-6311 to get more information or receive services.
Welcome to Project Independence and You.
And welcome back to Project Independence and You, Community Talk Radio on 88.1 FM and WCWP.org. I'm Rebecca Miller, one of your hosts, along with Otto, Lohse, and of course, Kristina Liu, who is our radio show producer. And I'm also the Director of Senior Citizen Affairs for Project Independence. Our guest today is Dr. Lawrence Cardano, and we are talking to him about hearing loss prevention, how treatment can maintain cognitive function, which I really, we can't wait to talk about that. And I know Otto really has very interested in that as well, and independence. So we're talking about, hearing loss prevention, which there is a lot of, there is treatment. And also we were talking about tinnitus and kind of the reason or some, I guess, is it definitive that they feel that it's kind of that syndrome you were talking about, missing limb syndrome, or is there other theories behind it?
Well, that's the main theory. It's an analogy. Phantom limb syndrome is an analogy to explain what's happening with tinnitus. But really, what the science shows is that in general, now I should say there are a couple of different types of tinnitus. So I'm talking now about the most common type. There are other things that can happen. You can develop tinnitus from certain types of medications and things like that. But the most common type of tinnitus is a result of the breakdown of the connection between the inner ear and the brain. And it's important to keep in mind that we were talking earlier about loudness perception, and the difference between having problems with loudness and having problems with clearness. You can have, all the research is telling us now that you can have more than 50% of the neurons from the inner ear to the brain not functioning properly and still have normal loudness perception. Now, you might have other problems like tinnitus or problems with clarity and background noise, but it doesn't show up on a typical hearing test as a loss of loudness. But that's generally the generally accepted, explanation for the typical type of tinnitus.
Right. And another thing you had talked about is that we may notice it more in quieter situations. I know. Yeah.
Right. And that's, that has to do with the fact that if the brain is missing some of the stimulation from the ear, which is leading to the tinnitus, then if you have more sound coming in, whether you're wearing hearing aids or you just have in a noisy situation, that tends to be helpful. So generally, most of the patients that we see who are treating for tinnitus in my office will tell us, that experience that you mentioned where it may bother you more, like when you're trying to get to sleep and everything's quiet, more so than when you're busy during the day and there's other sounds. It's typical.
Right. All right.
Hearing is a very complicated proposition.
Yeah.
And, it's one that it took me, I have to, in good faith here, say that I am a patient of yours and a happy patient of yours.
And he's a good patient.
Yeah. But it took me, typically they say it takes people about 7 years to admit that they really have a hearing problem. And I fell into that category. The TV was set up to numbers 23. Which was very loud for my wife, but I didn't hear that. And I think the biggest thing with hearing is that you don't know what you don't hear. You really have no idea what you don't hear. Trust me from experience. All of a sudden when you put hearing aids on, it's like that makes noise. The water makes noise when it comes out of the tap. I never heard the water hit the sink. It was like it didn't exist.
Yeah.
And so my point of this is that without testing, full testing, audiology kind of testing, it's very difficult to say how bad your hearing really is. Somebody can say, "Oh, I have mild hearing loss." How do you know? You have no idea what you don't hear.
No, that's a very good point. And it's especially relevant here that the typical hearing loss doesn't happen suddenly overnight. It's a gradual process. So you kind of, just like anything that happens very gradually, you sort of get used to it. It probably would be different if it would happen suddenly. But, I do a lot of public speaking, and sometimes I'll ask the audience, do you think a person who's developing hearing loss, if a person's developing hearing loss, do you think that that person with the hearing loss is the first one to notice it, or do you think friends and family members would notice it first? So, the answer to that is that usually the person with the hearing loss is the last one to realize it, because, as Otto said, they don't necessarily, they don't hear what they didn't hear. They don't necessarily aware of everything that they're missing. And this also happens with people who have had hearing aids for quite a while, and maybe their hearing is changing. So if we, like in our office, we at a minimum we want to check hearing about every year. But if we don't stay on top of that, the hearing is changing gradually, and they're hearing better with the hearing aids than they did without them, but they don't realize that they should be doing better, because we're not making adjustments or updating the technology. It happens so slowly they don't realize. That's a good point.
It's not, as you point out a lot of times, it's not just hearing, it's hearing versus listening. You can hear noise and you hear stuff, but that doesn't mean that you really know what's being said. There's a clarity issue, which in all frankness is not perfected yet, but it's better to have hearing aids than no hearing aids, because then there's no question about the fact that you don't understand what's going on.
Right. And that's the issue of clarity. No matter how much you're hearing, if you can't make out what the words are, we have patients who are getting into fights with their spouses because you told me this, no, I know you didn't, or having trouble at work because they don't know what the boss or the customer said, and the human brain is amazing. What it can do when you have good hearing. For example, in some of my presentations, we play an audio clip of two people talking at the same time. And if you have good hearing, you can decide to focus on the one person and you can make out what they're saying. You may not really make out what the other person is saying. And then you can change your mind and focus on the other person. Nothing has changed, but your brain is so good at this, if you have good hearing, that you switch to the other person. You may not really be able to make out what the first person is saying, but there's so many things that are happening between the ear and the brain to make that happen. Being able to pick up all the little distinctions between the two voices, so you can decide to focus on one more than the other, and all that. So the technology of hearing devices now has been gradually progressing to try to make up for all those little processes that you lose. And but it's a complex process. And it's why when we do our testing in the office, the typical testing where you just listen to beeps, if you ask people, have you had a hearing test and what do you remember about the hearing test, they'll say, well, I was listening to these beeps and I had to tell them when I heard the beep. I have never had a patient come to my office and say, I'm having trouble with my hearing, and the main thing I'm concerned about is I'm having trouble hearing beeps in a soundproof booth. I haven't had a patient tell me that yet. you know, what they say is I have trouble with conversation and so on. So we do testing with speech, listening to speech when there's background noise and things like that to tell exactly what's happening. But yeah, it's such a complex process that's why it requires more advanced technology in the testing we do.
Right.
Yeah, very, very good point.
Well, I think some situations are almost beyond repair as far as that goes, because somewhere along the line as a society, we have gotten into, you don't have one conversation. You're at a table and there's four conversations going on at the same time. You're having a conversation with somebody, but then somebody over there says, "Oh, Otto," In the meantime, I'm trying to listen to that conversation.
Yeah,
And
yeah.
some people are much more guilty of that than others.
Yeah.
They just don't hear the other conversation, and bam, they break right into the other one.
Yeah. Well, yeah, and in our office, we try to teach people, listening skills, and tips because it is true that if we catch hearing loss earlier, we can preserve a better quality of clearness. Once some people unfortunately wait until the clearness is so bad that we might be able to maintain them at that level, but it's bad already. But listening skills, for the person with hearing loss, and skills for the family member that's talking to them, getting the person's attention first, facing them, all these kind of things. It is important. One of my patients, I've been thinking about writing a book about this. Maybe someone gave me an idea of writing a book about how to be a poor listener. So that it would be kind of entertaining and people would know to do the opposite. But it's important. Like if you know somebody who has hearing problems, it helps to know simple things like it's better to talk slower than it is to talk louder. Because remember, because that helps with clearness, which is more of a problem than loudness. You want to get their attention first before you start talking. Simple things like that can go a long way.
Well, within the family, I can say, okay, one conversation at a time, or you're talking too fast, or some of the younger people mean well, but they talk fast because their mind is working very fast. But you can say to people, just do me a favor, slow down a little bit. Because there's no question that it's as long I've been wearing hearing aids now for I don't know how long, 15 years maybe, in that range. I mean, you were just a boy out of school. But the bottom line is that it gets better, but it never gets perfect, as you well know from me. I mean, there's, you're always trying to improve it. And then, as you pointed out, then all of a sudden it goes backwards a little bit. And I'm big at just making a note of it, what the problem was, where it was, and so on. The words that I'm interested in that I think would be worth exploring. I think everybody knows that there's now over-the-counter hearing aids that can be used in theory. All right, and we can get into that more later. But I think a big thing is going back again to the testing. If you don't know how bad your hearing is, how can you say that this is going to fix my hearing? But where I'm going with that are the words you like to use is the treatment plan or the treatment process.
Yeah.
Maybe just kind of tell us what, overview of that,
Right. So here's the thing. I don't blame people who are not audiologists or who don't have experience with this for thinking, based on all the advertising hype and so forth, for thinking that if they have a problem, the solution is to get a widget to put in the ears. The hearing aids are a tool that we use to treat hearing loss. And just, like a lot of medical devices, it's just a tool and it has to be used properly. So, for example, the start of the treatment process has to be a thorough evaluation. Otto mentioned over-the-counter hearing aids. There was just some regulations passed creating a category of hearing aids called over-the-counter hearing aids. And these are devices that are supposed to be for sale, through any kind of vendors over the internet and so forth. Just widgets for people to put in their ears without any evaluations or professional customization and so forth. And that's not what solves the problem optimally for most people. So the beginning of the treatment plan is having a thorough evaluation. We should check the level of hearing, do diagnostic testing to rule out physical problems like infections, earwax, things like that. Rule out all those things. Get information about how your brain is dealing with words and how much clarity you have for background noise and in quiet, and things like that. We even do now. This is something that cognitive function testing, because we find that before people are treated, the cognitive function screening scores are lower than they are after we have some treatment. But there's no way to tell exactly what's best for you or how to customize the devices and so forth without that kind of thorough evaluation. Selection of the correct devices for you. Now with digital devices, there's so many different ways to activate different features. So optimizing the device for you, and then follow up here. We talked about what happens when hearing loss is a progressive degenerative condition. So without the proper follow-up, besides the maintenance of the devices, and adjustments and updating of the technology, before long, even if you started out good, before long you're off track and not doing as well as you should. So that's just kind of a quick explanation.
Well, I know in that part of the process, my personal experience has been, I'll call it hardware. How the hearing aids fit into your ear are very important. And from personal experience, if they're not fitted properly and kind of customized for your ear, what happened to me is when you chew, everything moves. So when you hear sound, it's like Morse code. It comes in, it goes out, it comes in, it goes out. And the other one is when you talk, when you have the wrong fitted hearing aids, it's the same story. The sound just comes in and goes out, because when you talk, your mouth is moving and it affects the whole head. Yeah. This is far from a technical explanation, but just from my own experience.
But that's a good point. That the physical fit is just one of the many aspects of customizing the technology, along with all the other ways of acoustics and all the different parameters for noise reduction and so forth. That there's just no way you can just blindly throw something in your ears and hope that you're going to get best results. So that's an important point.
I feel like years and years ago, there was a much bigger stigma to losing your hearing. You're losing your hearing because you're getting old. You have to wear these big, horrible looking brown hearing aids. And I was just coming to mind when we first started Project Independence, we had these big advisory boards. And I remember being at a meeting, this woman, she would come every week, and she basically had everyone in the meeting yelling because she couldn't hear and she did not want to get a hearing aid. So instead of her getting a hearing aid, we had to get like a microphone. Everyone had to scream. I mean, to a point, and finally, I don't know if she wound up getting it, or I think she moved to Connecticut. But it was funny that we all had to kind of do this. When she was there, we're all screaming and yelling because she didn't want to get a hearing aid.
I'm laughing because I was in those meetings and I remember
her?
She's saying, talk louder. And I finally got fed up with it and I hollered out, get some hearing aids.
Right. Yes. Yes.
But, if you think of it this way, for me as a clinician, who's trying to help people, just think of how sad that situation is, because if that was somebody who was volunteering and probably had a lot to offer, or at least was taking the initiative to not be a couch potato and try to contribute to an organization.
Absolutely.
And to have that kind of, and how much more she would have enjoyed it, I'm sure, and everybody else would have gotten the benefit of her input if she had treated her hearing loss properly.
Right. And we had the nurses and the social workers talk to her. She did not want to get hearing aids. And I feel like, is there, I don't think there is much of a stigma today on hearing aids, and probably in part, not just because of how light they are and kind of sophisticated. I mean, they're so much more sophisticated looking today. And like almost people don't know if you have earbuds in or hearing aids, everyone's got something in their ear. So there's, I think that kind of stigma is gone. I mean, everybody, you have your little earbuds, you don't even have wires anymore. But I totally agree with you. I mean, it almost scares me that you could just buy a pair of hearing aids off the internet. I mean, to me, I'm not clinical, but I feel like it could make it even worse. If you have it up too high and then,
Yeah. Well, and having it's not the word we use, but if you have the wrong prescription, I was saying earlier that loudness is not the main problem. It's easy enough to make things louder, like you could just turn it on. But you can even if you make it loud enough, you can make the clearness worse. The configuration, you may have a different amount of hearing loss in the bass compared to the treble. So if that's not set up properly, you're making the clarity worse than it was, even though it's louder. If you have certain types of problems in background noise, and that's not, so yeah, it's, and my fear, as a clinician that's thinking about how to help people is, if my goal and the goal in our office is to help people to improve their quality of life, maintain their cognitive function, and live the kind of life that they want to live without the limitations that you have from hearing problems.
We actually have to take a very quick break, so hold on to that thought. It's very important. We're going to be taking a quick break right now. We're speaking with Dr. Lawrence Cardano. We're talking about hearing loss prevention and treatment. We will be right back with Project Independence in You.
So I get this call from my grandma, and she's like,
"What's a podcast, and how much does it cost?"
So I tell her, podcasts are like radio shows, but you can download them on any device and listen to them anywhere at any time, and they're free. And then she says,
"I see, but where can you find good ones?"
And I'm like, go to wcwp.org/podcast and check out the lineup of original shows, or download any podcast app on your phone or tablet and search for LIU Studios. And she's all like,
"Oh, that sounds easy."
And then she asked me what an app is.
LIU Studios podcasts, available on any podcast app. Those little button things on your phone screen. Just ask your grandkids.
And welcome back to Project Independence in You on 88.1 FM and WCWP.org. I'm Rebecca Miller, along with Otto Lohse and Kristina Liu. We've been speaking with Dr. Lawrence Cardano, and you're a doctor of audiology. We are learning so much. I know you're a longtime fan and friend, and I know that Project Independence is also a fan of yours. So welcome back. And before we go on, I just wanted to make sure, I know people will want to know how to maybe get in touch with you and learn about your program. So maybe if you could let us know the best phone number or your website.
Sure. So there's a few things. We in our office, we're focused on trying to educate the public, educate people about these topics, because there's so much misinformation. So if you have any general questions, the phone number at our office is 516-872-8485, 516-872-8485. But we try to provide educational opportunities. So if you go to hclievents.com, that will give you a little bit of a list of some things, like live webinars that you can join to learn about some of these topics. We're having a live symposium at the Malvern Cinema on October 27th. You'll see some information about that. So whether you want to just join something online, or you want to come to a live event, some information there. If you or someone else that you know has questions about hearing loss treatment, how to maintain, your independence without dealing with, without the problems that come with hearing loss, I wrote a book with a colleague, neuroscientist named Keith Darrow, trained at MIT and Harvard. So if you go to hcliboooffer.com, that's hcliboooffer.com, you can get a free copy of my book. And I think you might be able to see this, but that's the book. It answers most of the typical questions that people have. And if you are going to an audiologist now, or you're thinking of looking into, you're planning to go to an audiologist, and you want to be prepared wherever you're going to have the right questions to ask. If you go to Audiologist 10, that's the numeral 10, Audiologist 10, you can get a free report that you can use wherever you're going, so that you're prepared. The report was the cover of the report, and that's so because any audiologist will be, any good audiologist will be able to help you better if you know the right questions to ask and if you're involved. So those are just some ways you can get some information and some education and get some of your questions answered.
I know that, I'd be remiss if I didn't ask about the cost of hearing aids. And I assume that there are different kinds of hearing aids that people can get. There's a lot of seniors, a lot of them are on fixed incomes, are there. I know that insurance isn't always great with hearing devices.
Yeah.
So,
right.
Yeah.
So, So, this is always an issue. We want to, we want to make sure that hearing care is affordable. And so the thing to keep in mind is that whatever you do, just keep in mind that you want to have a good treatment plan, whatever it is and whatever you're spending. But there is a wide range of costs. We have a program to try to make things as the most advanced treatment with the most advanced technology as affordable as possible by having a monthly plan subscription. But I can't really give you one number, but I can just say that if you're on a budget and you want to make sure that you're getting the best treatment that you can, you just want to make sure that you have a good evaluation and you have the best technology you can get with a good long-term treatment plan. And with insurance, unfortunately there isn't any insurance plan that really covers 100% of a good treatment plan. Some of them fortunately do cover quite a bit, but you should check with your insurance plan first to see what they cover. Unfortunately, our experience has been that with a lot of insurance plans, you can call the insurance company 3 times and get 3 different answers.
Mm-hmm.
So you should just take your time with that, and that
isn't it like most of the insurance is strictly for the audiology testing part of it and never really for the hearing aids itself?
Yeah. There's a lot of that has been the case. There's a lot of variation. Unfortunately, apparently what seems to be happening is insurance plans want to attract subscribers by saying we have a hearing aid benefit, but then they do everything they can to pay as little as possible, and so it can be frustrating. And I would say, I'm not an insurance expert, but my experience has been when you're dealing with insurance companies, just know that you have to have a lot of patience. Don't be in a rush, and be prepared to be on the phone for quite a while.
Yeah.
Well, in my case, you also have a credit card arrangement with no interest. Right. For X period of time, which if you can pay your bills on time, it's no interest. So it's a good deal.
Right. So, and that's one of the things, like as far as questions to ask, there should be some options like that to make it as affordable as possible, whether it's no interest monthly payments or other arrangements. Um, so that for a lot of people, the most affordable way to get the best treatment, the best technology is a lease program, because generally after about 4 years or so, between the advancements in the technology and the deterioration in your hearing clarity and so on, after about 4 years, most people can be doing much better with new technology. So that's just another option, and you should just ask what your options are.
Seems to me that with the population, the majority of the population that's going to be 60 and over very soon, and a huge portion of them have hearing loss and probably eventually will require some kind of assistive hearing device, that this should definitely, like our senators and people need to kind of push for this kind of coverage. I mean, it just seems because I think, like, even we talk a lot about with Otto too, when you don't have the right device and you're not hearing, it adds to depression and all kinds of things. And someone could even think you might have dementia, or because you're not hearing, you're not aware when so maybe there needs to be a really big push for these insurance companies to start covering this very important device.
It's something that a lot of people have been thinking about. It's a frustrating situation, but you mentioned like all the problems that happen with untreated hearing loss, and you mentioned dementia. It is true that a lot of the symptoms of dementia, responding inappropriately, this kind of things, mimic the symptoms of hearing loss. I've had more than one patient whose family, came to me for evaluation. Family was convinced that, mom was starting to have dementia because I told her something and she didn't seem like she remembered it. And we find out later that it wasn't dementia. When you told her something, the reason it seemed like she didn't remember it is because she didn't hear it the first time. So that's true. Of course, some people might, I don't know if this is something you know about, but hearing loss is the number one modifiable risk factor for dementia. And it's something a lot of people don't think about. In fact, a mild hearing loss gives you a 200% increase in the risk of dementia. That's for mild hearing loss, up to 500% for more severe hearing loss. And it's something a lot of people don't think about.
Yeah.
And what is mild? Because you don't know.
Right. Well,
you don't, like we said in the beginning of the show, you don't know what you don't hear.
Right. But we're assuming that if they've had a thorough evaluation, they try to have a mild hearing loss.
Somewhere in your notes, I saw something which I hadn't really thought about, and that is that you do an environmental analysis.
Yeah.
Maybe just expand on that a little bit, because I never thought about that one before.
Well, there's two types of ways you can think about that. Of course, we talked a little bit earlier about how to avoid or how to minimize, you're developing more hearing loss. And of course, if you're around environments where there's a lot of loud noise, that's going to cause a problem. But some people are involved in more noisy situations than others. There are some people are in environments where there's groups of people and background noise, maybe at work or leisure activities, and some people are not. Although we see a lot of patients who tell us that they don't get involved, they're not involved in situations where there's groups and background noise much. And with a few questions and having a little bit more discussion, we find out that that's mainly because they're avoiding those situations because of their hearing loss, and they know they're going to have trouble I have a patient just recently who was telling me that she used to once a week go to a diner with a bunch of her friends, and she stopped doing that now because, right, there's a bunch of them there, and there's other people in the diner, and there's music, and it's so hard to follow the conversation that it's more of a frustration. And so she would be, that's something that she would normally enjoy, and we're able to get her back to that by treating her hearing loss. But to say that I don't need help because I'm not in those situations, it's kind of circular reasoning, because maybe you would be, if you had to.
Well, part of that analysis too, though, isn't it that somebody can wear hearing aids that, maybe in the beginning, like they try them for a period of time, and then when they come back to you, you can analyze what kind of environment they're normally in. Like you show me on the screen, small conversation, crowds, that kind of thing, which is the technology.
Yeah. So, I mean, we see quite often people who the technology in some cases can tell us how much of the time you're spending in just one-on-one conversation, or quiet where there's no conversation, or large groups, that kind of thing. So very not unusual for us to see people initially when we first treat them with hearing loss, and maybe they come back the following week, where we see that they're spending most of their time just alone without any conversation. And then over the course of the next few months, we start to see that the time that they're spending in conversation, small groups, larger groups, starts to increase, as they develop confidence because they're hearing better.
But that enables you to adapt the software, if you will, based on what kind of lifestyle people live, or.
Yeah, it's another way of customizing things. Although now all the research is starting to tell us that we really want to optimize, we want to get as close as possible to normal hearing. And we'd like to have whatever is as close as possible to normal hearing in whatever situation you're in, rather than trying to have a specific type of setting for one specific situation, which is, it's not like normal hearing. But yeah, that does help us to, especially troubleshooting, because someone might tell us that I'm doing well in one situation but not another. So we can troubleshoot that. Yeah.
So we don't have a lot of time left, but I'm just very curious because, we talked a little bit about the rock and roll generation. I mean, I remember and regret every concert I went to. It was always the goal of me and my friends to get to the front, like at Nassau Coliseum or maybe even Madison Square Garden, and you're by these speakers. So I know probably what I've done to myself, and I still continue today to go to concerts. So I'm not going down to the stage. Well, maybe once or twice. So of course I have sons. They're in their mid-20s, late 20s, and they have the most amazing head things. I mean, the sound, how loud. What are their futures going to look like? I mean, we know they'll be okay wearing. I mean, I'm thinking that maybe somebody should come up with both a hearing aid combo with like earbuds. So, because
Yeah. Well, I as I don't know, as I'm an amateur musician, so I would never tell anybody, not to enjoy music. And actually, music, as a clinician, we know that music stimulates all different parts of the brain, in a lot of ways. But if you can enjoy music at a level where it's not going to be doing damage, that's certainly going to be better. And one of the things, just there's some simple things that can help with this, which, like, for example, if you're listening to music and you have some, in a situation, maybe it's a public place where there's noise around you, there's a tendency to turn the music up louder than you even normally would to overcome the background. So if you can avoid that, headsets that will block out surrounding noise will allow you to have the sound of the music a little softer. Right? A lot of programs, like I think software, like some of the Apple software, even Android. Sometimes when you increase the volume to a certain point, it gives you a warning.
Okay.
Where it says, above this, this can, too much loudness can damage your hearing. So pay attention to those kind of warnings.
I get that with the Connect thing.
Right. So
if I put the volume up too high.
Yeah. So those warnings are there for a reason, and it's something to pay attention to.
Well, so what do you think of that combo hearing aid, also listening device? You heard it here first.
I'm going to work on that. I will give you credit when I do.
Okay. Well, you guys are the witness for that. I think there definitely be a market.
I mean, there are things that we can. I mean, there are a lot of things we can do with hearing devices now. So, sometimes the devices are controlled by an app on your phone. So we can have a setting where, let's say, it kind of shuts off the sound and acts as an earplug, depending on the situation you're in. We also we do have to be careful when we program and adjust more advanced hearing devices. We have a limit based on the testing that we do. At what limit that the loudness can reach. So that's protecting your hearing. But that is a good suggestion.
Great. I shouldn't have said it. Now he's going to run with it, and I'm going to be doing this radio show.
I promise I'll give you credit.
Hearing is
do you play out if you're a musician? Are you in a band? Can we enjoy?
Well, not right now. I will let you know. I've been when I was younger, I was doing coffee houses and stuff with my guitar.
Okay.
But he actually played the guitar on our show.
Yeah.
Oh, even better. But
right, but he hasn't been back.
We have to go to break. Thank you so much, Dr. Cardano. We learned a lot. Really grateful for all the information. Anybody has a question or needs the phone number, please call 311. You can ask for Kristina or I, and we'll make sure that we can connect you to Dr. Cardano. We're taking a break, and we'll be back with Talk of the Town. You're listening to Project Independence in You on 88.1 FM and WCWP.org.